All right, so Jaryn, Weir, Tara Boothby, and we are going to talk about EMDR. So EMDR is eye movement desensitization reprocessing therapy. It's a model that we're both passionate about, and it's kind of it's power therapy, so it's a little bit tricky to understand. We thought maybe we would just take some time to really explain what is EMDR. So Jaryn, how do you explain what EMDR is?
Yeah, so EMDR, when it comes to our brain processes information similarly to our stomach. So if I were to take a bite of a sandwich, chew it up into little bits, and then swallow it, my stomach then recognizes, oh, there's protein, we know where we store that. Oh, there's calcium, we know where that goes. Anything else we use properly gets stored, and then anything we don't need gets discarded. So that would be like if I took in just a regular everyday kind of situation in life, like a day-to-day thing. But if our brain takes in too much of something or too often of something, then that would be like if I took a huge bite of a sandwich, swallowed it whole, and now it's surrounded in saran wrap. So it's unable to like pull out all those nutrients, and it's just like a lump kind of sitting there. So that would be like if I experience something really traumatic or distressing, it's kind of like, for lack of a better term, it's this lump stuck in our brain that's not able to process. And so a way to like process that undigested memory is through eye movements or like body tapping, which is, there's a fancy term called bilateral stimulation. And so that's like activating both sides of the brain so that we're able to like make those connections and to better understand that situation.
Yeah,
So,
I love hearing people explain different things, and it is interesting to think, even just like that metaphor of swallowing food wrong or water going down your windpipe. Like there's these different ways that we could sort of think about traumas. So some of what I will notice with clients, similar but different, because I mean we're not neuropsychologists, so a neuropsychologist might be better able to explain the parts of the brains and all this stuff that is interesting, but I speak more through metaphor, and just like Jaryn is right now. And so with eye movement desensitization and reprocessing, what it's like is we're really going to be working to desensitize the emotion and reprocess the thinking about the trauma that's happened. So Dr. Carolyn Leaf will say that healthy memories look like trees and trauma looks like a thorny bush. And so the thorny bush idea is it's uncomfortable. And when our brain goes up to touch it, it's like, is that really true? Did that really happen? The emotion and the cognition is distressing. It's disturbing. We're looking for units of disturbance is another sort of one of those fancy words or terms that we use. And so what we're trying to do is figure out how to reprocess the emotion. Yeah, that really did happen. We can feel those feelings. We're not trying to remove the feelings. And that we are helping to desensitize the thinking so that those thoughts, those worries, those troubles about this trauma, this event, this view of self or others, whatever we're targeting, that we can better make peace or just a relationship with the thoughts about it. And similar to what Jaryn was saying about bilateral stimulation, which is, can be, this is the butterfly hug, or pulses with the buzzies. We have electronics that we use for EMDR, or the light bar and movements with eyes, is that through bilateral stimulation, I say it's like both hemispheres of the brain are engaged, all the street lights are on. So we can just process through trauma that much more quickly. It's to help move through things, and the brain really does this magical, curious thing of linking together. It finds the sandwich and it starts to figure out, okay, what is the calcium in this? What is the protein? What are the different parts? And gives us these big insights. So it's pretty awesome for the clients that like it, or for the clients that it works for. Yeah. Okay, go ahead.
Yeah. Oh, yeah. I was just gonna give like an example, kind of like, so it'd be like, say someone got into an accident on the Henday at a certain point on the Henday, and every time they drive by that certain location, they feel a little bit like tense, or they're white knuckling that steering wheel. And maybe it was like a red car that hit them or cut them off or something. So maybe at any other point in the city they see a red car, they're feeling that same sensation, like
Yeah.
my heart's starting to race all of a sudden and I don't understand why. But EMDR, it connects, well, yeah, the eye movement or that bilateral stimulation, it connects like the emotional feeling sensation side with that logical rational side and connects them.
Right.
So that the next time if you're driving on the hen date in that particular spot, you don't feel as activated, or the next time you see a red car, maybe you're not feeling, that activation again.
Yeah. And that's, I mean, what we know about therapy and theory is that helpful theory works with the thinking and the feeling, and it just naturally connects to our behavior. Like that's the model of CBT, but that's true for the variety of work that we do with people as we're thinking, feeling, doing humans. So the other piece with EMDR is thinking about like who do we use EMDR with, and I mean I use EMDR with a variety of clients for a variety of reasons. So it could be like a car accident, it could be a major big T trauma, we'll say, so something that was a threat of harm to self or others, at war, all sorts of really difficult things, and then some smaller things, anxieties. I like to do a lot of attachment focused EMDR, so that is generally targeting more of the cognition, a view of self or others or the world, feeling unsafe, abandoned, neglected, avoiding something like that. And so that's a lot of the EMDR stuff that I'm doing these days.
Yeah, I feel like, when people hear EMDR, they think it has to be this really big traumatic thing that they've experienced. And so sometimes when I've brought up the idea of EMDR with clients, they get a little bit worried thinking, oh, are my problems really that big? But EMDR works great even with like smaller T traumas. So yeah,
and we can do it on all ages. So we can do it with really little kids, and the parents are involved if we need to do it on young children. And parents can be in the room. I think one of my best experiences actually was doing EMDR on some teenagers and having a parent sit in. I had thought that would be so weird because EMDR is a weird process. And I thought, boy, to have another person in the room while I'm supporting somebody to be individually processing, I just didn't know how it would feel. But it turned out amazing, and I think it was really helpful for the parent's understanding and the child's understanding. And I don't know, any other sort of things you notice about using EMDR or?
Yeah, something with the like eye movements, people worry that, oh, is this some form of like hypnosis? But you have full control of the situation. It's totally different than hypnosis. But that is something people like worry or
That's
question.
a natural question and worry. I would say hypnosis is in a category of power therapy. So they're in the same category of like, how do we move more quickly? Like we are using I use electronics, so it's a little bit different. And it's a very internal process, but I have said, and I don't know what a theorist would say, I've never asked one of my trainers, or but I view EMDR as the opposite of hypnosis. So hypnosis is more of this moving away from, and EMDR is more of this really moving in, alerting all of the parts of our brain, so we're very, very engaged with whatever we're targeting. So what is it like? I mean, the other thing is like we do EMDR on ourselves, and then I've done EMDR on colleagues and stuff like that. So what is EMDR like? I'll tell you how I explain it, and then I'd like to hear how you explain it. So what I say when I explain EMDR the first time I'm moving through it with somebody, I'll say, sometimes things will change, sometimes they won't, and there's no supposed to. So even like I was telling Jaryn before we started, I'm like, oh, I'm a little hungry. So if I was hungry going into EMDR, I might at one point just notice, my stomach is growling, or I could notice a noise in the hallway. I could feel a headache come on. Like there's different ways that our body will show up. Just let whatever happens, happens. I see 3 sort of typical types of movement for people in EMDR. And so one is that people will go through literal, actual life events and stories, and their brain is just naturally tracking different things. When I was 7, this happened. When I was 12, this happened. For some reason, I'm thinking about yesterday, and this happened, and then I'm thinking about when I was 18. Like, it's not necessarily in a timeline order, unless I'm asking them to be in a timeline, which is a protocol that we could do. So sometimes it's literal events. Other times, it's a lot of body stuff. So people just be noticing, like, my shoulders are tight, or I feel tears behind my eyes. I just feel the sensation to run, or there's like something sort of like a red spot in my heart somewhere. Is that weird? But there's body talking. And the third way would be, really, it's like Allison fell down the rabbit hole, and it's metaphors, and it's strange, otherworldly, more dreamlike. And then really frequently it's like some sort of mixture of all three or a couple of them. So it's really different experience, and I think that's part of what goes on for people. There's this, like, I have to trust myself as the client to get inside and have this experience that I won't know what it is, and you really can't explain EMDR well unless you've experienced it.
Yeah, it is kind of a tricky process to explain, because it's allowing the brain to go back to a certain time in their life, or think about that certain event, which is activating that, like, neural network. And so what's attached to that neural network can be other memories. And so in EMDR, people might, recognize, oh, I'm all of a sudden thinking about this random memory when I was super young, and I don't know why that's there, but it could be connected to that, like, network, and that network could symbolize, like, a certain negative belief of, like, I don't matter, I'm not in control, I'm not worthy, I'm not loved. Like, there's so many different ones, but
and it's just really interesting too, because we can be targeting, like, something current, a conflict with a spouse, or a difficulty in a relationship or something like that. And then in EMDR, the person's like, all of a sudden I'm thinking about my primary attachment figure, and there's a similarity of how I felt, like, bad or separate from them in our relationship as a child. And when I'm noticing this, my brain is starting to say, hey, is this a similarity here? So it's interesting how the brain does that. And how I view it is that, like, the emotion center in our brain is called the amygdala. I kind of view their trauma as, in the amygdala is my inner child, and mine happens to be a girl, but yours could be whatever. And she's in there watching television. So something happens in my life. I see that red car, I drive past the Henday spot, that person I'm not getting along with, and she turns my trauma channel on in my brain. So whether we're cognizant of it or not, there's this trauma channel. There's years of programming. So if my negative belief is I'm a failure, I'm a fraud, I'm unlovable, whatever it might be, anytime that instance occurs in my life, my little inner child, she's just trying to help me out, trying to figure out the right channel to turn on. But unfortunately, there's just a lot of content at times that I've reinforced or experienced proof of those attachment fears, attachment needs, and yearnings.
And I think just kind of going off of that, there's people wonder about that desensitization part in EMDR, and so it's like desensitizing that experience,
right?
So then we can replace it with, like, a positive belief or a positive, image or that sort of thing. So it's like targeting that, like, negative belief of, I wasn't in control, or I'm not in control, or I am not valued, to, like, I am valued, I am worthy, I am loved.
And EMDR is not removing emotion, and it is not removing the pain of those negative thoughts. It's a process of really valuing and heightening so that we can experience it, like from a DBT perspective, we'll say ride the waves of emotions. And EMDR just helps us stay on that wave with someone safe who's trained, and then we can actually trust the experience or just like do it. It's like EMDR is like, okay, I'm just doing it, and it's hard and it's intense. Sometimes clients will say it felt like hours. Sometimes they'll be like, that just felt like 2 minutes. So it's very strange, but it is exhausting. And I would say it does not always work for people. So some people just don't like it. They don't click with it. It is really hard to trust ourselves. So some people are just like, it's too much. I feel too much of a loss of control. Sometimes people have had a concussion, or they have had they have a dissociating experience, and that can make EMDR very hard to do as well. So it's not necessarily the therapy for everybody, and some people just really don't like it.
Yeah,
but it is worth trying.
Yeah.
Yeah. Would you say any more about like why EMDR doesn't work, or?
Yeah. Let's see. I feel like I had a thought. Now I need EMDR to bring up that thought.
Yeah.
Again.
Right. When it comes up, just bring it up. Right?
Yeah.
Yeah. So it's okay. It's not cut out for everybody. But if your clinician is saying, hey, why don't you try it? It is worth trying, because it's super cool, and if it works for you, it's great. I find too, so this comes in a bit into my experience as a EMDR clinician, but also what I observe with clients is that we can be sort of leery. So people will do EMDR, it works great, and then they're like, I don't really know. And what I noticed earlier on in my career as an EMDR therapist was I might be expecting to do EMDR with a client, and then I would be apprehensive, or I just didn't quite know if I wanted to. And if we went on to do some other type of therapy, I was like, okay, fine, dodge EMDR for this hour. What I've realized is actually how hard EMDR is on us as clinicians. We are working really hard in the room. We don't always notice how hard we're working, but it is an experience of co-regulation. So when somebody is processing through that level of emotion or negative beliefs, and we're present with them, it really just activates all their attachment systems, our co-regulation. And so as a clinician, actually, I feel quite tired.
Yeah.
You know, if I do like 2 or 3 EMDR sessions in a day, I notice a difference.
Yeah, so I remember what I was going to say.
Go for it.
Yeah, with like EMDR, you get a lot of bang for your buck. So like, going along with that tiredness, right? Or for clients, like what they often experience is they'll be reminded of like other past situations after therapy, and that's just like the brain continuing to like bring up those experiences, right? It's still activated, and it's still like working towards like healing those like memories. Yeah.
So we'll say processing can continue after the session. So sometimes people have thoughts or feelings, dreams, memories, and then we just say, you could jot that down and bring us in next time. But it is pretty powerful. You know, the brain just starts moving, you're on that channel. And for some people, the benefits of being on that channel continue. Albeit that some channels, our big T traumas, are really painful channels in our brain we don't want to be on. And I think that's another reason why some clients try to stop, is because the level of disturbance is so high that some clients just really can't talk themselves into it, and we have a hard time counseling them back into EMDR. But that's okay. You know, we love and accept people just the way they are, because there's other amazing things that we can do. It's just EMDR is pretty damn cool. And when are you finished? So interesting, because I've been in private practice for 17 years or whatever it is in the same location. I have some clients I've seen off and on for 17 years. And I had someone come back to me we had done trauma therapy years ago. They came back, I want to do more trauma therapy. I talked to Tony, who's a somatic therapist, and I was like, do you think we ever finish with trauma therapy? And it, it was an interesting conversation with Tony, but part of what I was wondering from speaking with him and just continue to think about is, I noticed with adolescents and trauma therapy, it makes sense developmentally. They get to a place and that's it. Their brain is just like, I'm done. And so with adolescents, I've made peace with that. It's like, oh, this is our developmental pause, and maybe I'll see you in 6 months or a year or whatever it might be, or not. But then with adults, I wasn't really cognizant of trauma. We kind of get to the place where it's more manageable. Sometimes that's enough. Other times a person will get more managed with a clinician, maybe let's say at 20, and then at 25 they might come back to that clinician, or they might try somebody different because it's okay to see somebody else. So if you've done some good trauma work, or maybe you're not sure if you did, but you got to some place and then you realize I still have stuff to process through, big or little T trauma, then you can go back to that person if you choose, or you can try somebody new, which is fine. Yeah. What do you think, Jaryn, about trauma in particular? Like, do we ever finish working with somebody's trauma?
Yeah, I think it's kind of depending if it's like a big T trauma or a smaller T trauma. I've noticed that smaller T traumas can be like fully resolved or healed. But yeah, bigger T traumas, it's difficult, right? Because they're so deep rooted and they go way back down, in that neural circuit, right? And just it's
and we can't change big T traumas. Like, some things we're changed forever. The pandemic, we're changed forever. That has adjusted and shifted our beliefs about ourselves, other people in the world, in a way that we can have more peace with, but we can't erase 2 years. And EMDR doesn't erase the trauma. It creates more ability to say, okay, I love and accept myself even though I have this trauma here. Yeah. And I wonder too, when you're speaking, I think with kids or with even adults, but people where this feels like a big T trauma, or maybe I even experienced it as a big T trauma, but it is more rooted in something developmentally appropriate. Like a child who is extremely fearful of thunderstorms, and maybe they experienced a trauma with a thunderstorm, and we can view it as a big T trauma because they're afraid to death. But it's developmentally appropriate, even though it's gotten so intense for them. Something like that, there's a high likelihood, whether it's with EMDR or some other type of therapy, that will get completely processed through. And then it's sort of like, we all have our traumas, they don't leave us, but if we can make friends with them, and we can sort of, from a narrative perspective, have space to have conversation, to love them, and to see their value in our life, that's a hard part, especially with the bigger traumas, is like, bad things happen, we make meaning from them. It's Viktor Frankl, right? So okay, so anything you want to say, anything that, as we sort of think about winding this conversation down, any other?
I love EMDR. I think it can be like really, I'm a little bit biased, but I think it can be really effective for a lot of people. And so I do talk to a lot of my clients about it. But with that being said, there are also many other like therapeutic approaches.
Right.
And we can always take like an eclectic approach to make sure we're, meeting our client exactly where they're at and what they need.
Yes, and I appreciate you saying that. Like, I'm an experiential attachment focused therapist. And so my goal is attachment and experience in the room, and EMDR fits in with some of the way that I work with people. And when I am doing EMDR with clients, usually if we're doing EMDR focused therapy, we're doing 2 or 3 EMDR sessions, and then we'll usually do some sort of consolidation session where we're talking about attachment or the meaning that's being made, how the behavior is changing in the person's life, and how they're noticing their feelings and catching their feelings that are distressing, and having experiences of the emotions that are more enjoyable. Awesome. Yeah. So it's a great model. There's tons of great models out there. I would say a big deciding factor is you want a great clinician that you feel safe with. And if you don't feel good with the clinician you're seeing, you don't have to see that person. But Jaryn's awesome too. So.
Thanks, same with Tara.
We're okay. We're okay. Some people like us. Awesome. Yeah. Thank you, Jaryn. And I know, Jaryn, you're so passionate about EMDR, and that's why I thought it'd be really fun for us to talk about this.
Yeah, absolutely.
Yeah. And hopefully this makes sense. Hopefully this is helpful. It doesn't hurt to look into some articles and different things on EMDR to just inform yourself, because there's a lot smarter people that can say it better than we did.
We like to dumb it down just so people can understand, because it is a complicated.
I like living life at a grade 8 level of like understanding. It works better for me to understand people, and I think that it helps other people feel understood and known by me. Like I just, just sort of like hang out in the young adult fiction section of life.
Yeah.
All right, take care.
Thanks, guys.